So you say no more dentures. Elaborate.
Dental implants have opened up the door to eliminate the conventional denture. If you talk to denture wearers, even people who claim they like their dentures, they will tell you, I get along with them. I do okay. You'll never hear anybody say that they think they are the greatest thing they ever did. Okay. Dental implants allow us to provide a spectrum of treatment depending on how much treatment a patient feels they need to have in order for their dentures, their teeth replacements to function.
So on
better.
the lower.
On the lower. The classic problem with the lower is, since the tongue will push on the conventional lower denture, it becomes loose and is very difficult to function with. The simplest therapy is to place 2 implants, basically in the area of about where the canine teeth were originally, and we have attachments that allow the denture to clip in to the top of the implant, and that stabilizes it. It does not come out in speech. It helps support it for chewing function.
So no more adhesive.
No more adhesive.
Okay,
Yeah,
so what's the next level up?
The next level up, some patients still want a little bit more stability. They like a 4-legged table. And so we'll add 2 more in a little further back. And this gets rid of some of that rocking. And these restorations are extremely well retained. So I have patients who come in and literally have to pull hard to get them to disengage and come out. Sometimes I can't do it because the patients have figured out the way to get it on and off, and I just let them do it.
And they could eat and chew?
And chew anything they want.
Now what about a fixed set of teeth?
Now, some patients...
Like that don't come in and out.
Right, that don't want to come in and out. Some patients want to get rid of the removable concept completely. And in those cases, on the lower arch, we can do that on only 4 because the mandible is very hard bone and it will support that. In the upper jaw, we need to have a few more just to be sure in case we lose one. So we'll go to 6 usually if we can, 5 or 6, something like this. And the options are to connect them with a bar and have a removable component go on and off the bar so it doesn't touch the tissue at all. Or it can be, frankly, screw retained, where the only person who's going to take it out at any time is me or their general dentist.
And they can eat and chew whatever they want.
Eat and chew whatever they want.
How old can you be to get dental implants?
How old do they live?
Is that right?
Absolutely.
I mean, are there 80, 90-year-olds?
80, 90-year-olds, absolutely.
That are getting dental implants?
Absolutely.
Are they more likely to fall out if you're 90?
No, that's a myth. The physiology of bone, it may slow down a little bit, but it heals. The jawbone is a dynamic bone. It is a very fast healing bone in comparison to the rest of the body. And so there really are no age restrictions on this. I think the oldest patient I've done so far was 87. Wow. And absolutely loved it. Absolutely loved it.
Could he?
It was life transforming. That individual, she had lost her teeth due to dry mouth problems, which is epidemic, another show topic actually, just from decay. And we placed 4 implants on the lower, 6 implants on the top, and got her into screw retained fixtures. She was able to finally eat. Her nutrition improved, her weight improved, and we see this sort of slow wasting of older patients because they're nutritionally handicapped. They don't have the basic dentition to allow them to chew so they can extract the nutrition from their food. So even though they're eating, they're not getting the benefits of what they're eating. So not only are we restoring aesthetics and to the patient, but we're also affecting their overall health by giving them something that allows them to function.
So no more dentures?
No more dentures.